and welcome to yet another episode of Health Mantra with me, Dr. Stacey Fernandez. In the studio with me today is Dr. Rakesh Deshmane. He's a cardiovascular thoracic surgeon at Manipal Hospital, Goa. Dr. Rakesh has done his MBBS at the Government Medical College in Aurangabad and went on to study his MS in surgery in Pune and his MCH in cardiovascular thoracic surgery in Bangalore. Dr. Rakesh, welcome to the show.
Thank you.
Doctor, what are the most common cardiac conditions that you have seen in practice?
If you consider cardiac surgery, there are two. One is called as congenital cardiac conditions, which are there occurring from the birth, and there are adult cardiac. So most common what we see in the practice are the adult conditions, and amongst that most common what we see is the coronary artery disease, as you know, means nothing but the blockages inside the arteries of the heart. And that is the most common cardiac condition which is present today. Second, in the adult side, we see cardiac condition we call as something called as valvular heart diseases. Heart diseases, which is means the out of the four valve, they either degenerate because of aging or because of some disease we call as rheumatic fever or something. And in the pediatric population or congenital, we see the diseases we call as something called as cyanotic, in which we call it blue baby syndrome, and the another are we call as acyanotic. They are mostly hole in the heart, in the general people what we call it. So, but today our focus will be mostly on the adult cardiac surgery, which we see in the most of the common things we see in the practice.
So, doctor, how does a patient know that he has a cardiac condition? What would be the symptoms that he would usually come up with?
Because now, as you know, the cardiac conditions are increasing. The symptoms, what people typical think that just chest pain is the only cardiac condition or cardiac symptom of coronary artery. But it's not like that. So many people, specifically, as you know, cardiac or the coronary artery disease are most common in the patients who have the diabetes. Okay. So most of the diabetic patients, they don't get this typical complaint of chest pain because of we call it something of neuropathy, diabetic neuropathy. So the other symptoms what should be the which is alarming includes what you call as they are capitalized, we call it as angina. It like breathlessness on walking or walking uphill, not on the straight. Or after the food, we call it as postprandial angina. After having food in the morning or night, you feel that there is heaviness in the breathless or heaviness in the chest, or sometimes the pain in the jaw on the left side, from the left side, from the jaw to the left shoulder to the back, up to the hand. So these all are suggested we call as something called as cardiac angina. Otherwise, if we consider as angina, otherwise it is the cause is something else. Okay, so this we see in the coronary artery. Other symptoms what we see in other like symptoms of heart failure, like swelling, the pedal edema, or swelling on the legs, breathlessness on the when you walk. Or when the heart failure is severe, you see because heart is the main organ which gives blood supply to so all other organs like kidney, liver, they go into failure. So you can see those failure picture also in the patients who have heart failure in that case.
So most of the times, I think the public is already aware that of these symptoms, and they usually seek medical help. Once they are at the hospital, how would you diagnose a cardiac condition?
Most of the patient who comes to the cardiologist, either they come to the cardiologist or they come to the physician, general physician, everything. So they come with this complaint most currently. So there are the investigation part comes into two parts. One we call as non-invasive and invasive. Non-invasive means we don't put a cut or anything. So these are the simple investigation which can be done on the OPD basis. So in that what we do commonly is your ECG or electrocardiogram. On that, if there are some changes or other things, we can go for further. The second investigations come as like we call as 2D echo. In general language, we call it the sonography of the heart. In that we come to know how is the function of the heart, like how is the pumping of the, in general we call it pumping of the heart, how is the overall condition of all the valves of the heart. Is there the valves are leaking, or is there a problem with the pumping of the heart? And then to look out for the what we call as I told you, ECG is just what we call the resting ECG, which is not. So if you are suspecting the patient that he is having underlying any coronary artery disease or blockages, we we measure them to the something test we call a stress test, or you must have used a treadmill test. In that we make the patient to run on a treadmill, and while doing that we do the ECG, and if there are underlying some blockages or that, there will be ECG changes and we can see on that. There are like some blood tests and all those things, like your lipid profile, your sugars and all those things. So that also can be correlate. That are just to correlating to the we call as cardiac conditions.
Like yes. So doctor, once a patient is diagnosed to have a cardiac event like a heart attack, what would be any other specific tests that are carried out on that patient?
Yes. As I told you, this patient who present us with the heart attack, many of them they present with the heart attack in the emergency department. So they, in that case, what they do in that case is some blood test we call as cardiac enzymes like tropi or CPKMB. These are the that can be checked. If the enzymes are high, then there is high suspicion that patient has got the heart attack.
Right.
And the final of all this thing is concluded by we call as one investigation. In common language we call as angiography. Or coronary, what we call as coronary angiography. In lewd language, coronary angiography with nothing but like we call it as X-ray or CT scan of the heart vessels. In that they most of the angiography now they do through hand to radial artery. They put a catheter inside cardiologist and they inject a dye to see how is the condition of the artery, whether there are blockages are there, if how many are there, whether they are critical, non-critical, and the further all the plan of the action will be decided after doing the coronary angiography.
Right. So doctor, what is coronary arterial bypass surgery?
Okay. So, like I am a surgeon, so if, as I told you, when we'll come forward from the coronary angiography, once the patient's coronary angiography is done, either because of positive treadmill test or because patient had a heart attack, then as I told you, we will evaluate what is there on the coronary artery disease.
Right.
If the patient is having, we call as most of the time triple vessel disease, they call TVD also, and patient is having other comorbidity like diabetes and blood pressure, and more than the triple vessel or blockages in all artery, it is however the nature of the block that is most important. If the blockages are long, they are multiple in the multiple arteries.
The type of blockages,
yes,
and
that
the
is most
number of blockages.
That is most important. And if the blockages are long, they are in the multiple arteries with the patient having other comorbidity like diabetes and all these things. Those are the patient we prefer to do a bypass surgery. On contrary to that, if the patient is having only one block, not there are two blocks, they are very small, discrete in size in all the three arteries, but the patient is young and without this comorbidity.
Right.
Because now cardiology branch also came with very good procedure. So in those patients, they can be they can go for the angioplasty, or we call it PTC. So this is like nowadays because of the this thing, most of the Manipal we follow what we call as heart team approach. In that cardiologist, cardiac surgeon, all of us see together, we see the patient profile, and then we take a decision whether this patient should go for angioplasty or this patient can go for the bypass. That we decide.
Doctor, at Manipal Hospital, Goa, you have touched a milestone by doing nearly at least 500 beating heart surgeries. So I would like you to tell our viewers what exactly is a beating heart bypass surgery.
So as we discussed earlier, the coronary angiography patient subject to the coronary angiography, and when the angiography report comes as a severe triple vessel disease or when the patient is having diabetes and all of this. So initially, when consider the bypass surgery was done, we call conventional bypass, or conventional bypass surgery is done on the cardiopulmonary bypass, or in lay language, heart pump or heart lung machine. See, when we do the surgery on the heart, we have to stop the heart, make it sin, and then the function of the heart and lung, because both are connected, is taken by that machine, that heart lung machine. We do the bypass operation on that machine, heart lung machine, and then we slowly restart the heart, and then slowly wean that machine. This was the standard practice of doing the heart surgery. But because of newer advances and technique thing, so this but problem with this technique is this one, but this cardiopulmonary bypass we call as something called as extracorporeal, because blood goes into that cardiac machine and comes out. So there is a some inflammatory response, chances of bleeding,
Right.
these are more. So to avoid this, the technique of beating heart surgery was invented. In that, what we do is actually we don't use this cardiopulmonary bypass machine or CPV machine. We do the surgery on heart beating itself,
Right.
and for to do that, we have some special instruments, and we call it something
Yes.
like octopus and starfish. So these are nothing but we call as stabilizer.
Right.
So only the part of the heart where we do the bypass operation, that is stabilized by this octopus stabilizer. The rest of the heart keeps beating,
Keeps
and you
beating.
do the anastomosis or bypass on that artery while the heart
is
is
beating.
beating itself. So the only thing is that for this surgery is that your time means for your time to complete the anastomosis, hemodynamic instability which occurs, that has to be managed.
Managed.
Otherwise, this is a very
Right.
good option, because you main advantage of like
Beating
beating heart
heart.
surgery is, like as I told you, due to we are not using the heart lung machine, the chances of bleeding, chances of infection, chances of we call as having the stroke, because we don't handle the aorta or what we
Right.
main artery, are less.
Less. Right.
And even the ICU stay is very
the
less. So
recovery is
patient
also
recovery is
faster.
faster. That's the main
Right.
thing.
Another milestone that you've also done is total arterial bypass surgery. Could you tell
Yes.
us more about what is that and what are the benefits of that type of surgery?
See, what is basically a bypass surgery? When we do the bypass, we use the conduits. We call as conduits, or which are the material, or which are the part which is used in for the bypassing the blocks.
Bypassing, yeah.
So in overall in the world, 90% of people, or 90% of operations or bypass operation are done with one artery. We call it left internal mammary artery, and saphenous vein, or from the leg. Bypass. But the problem with those saphenous vein or leg veins, where what we found as what we call as longevity or patency rate of the saphenous vein is like 50% at the 10 years.
Okay.
And if you see the arterial bypass, arterial grafts, they have patency rate of almost 90% at the 10 years. Means if
Right. If you compare them, the arterial grafts are better.
they are doing very better. So they come with the idea of using the arterial grafts. So commonly arterial conduits what we use when we do the total arterial is like left internal artery, right internal artery, mammary artery, and radial artery.
Radial artery.
So advantage of basically advantage of doing
Of an
this is
arterial graft.
arterial graft is the longevity. Means patient will not need a future intervention, or the
Right.
chances of those graft to get blocked are very less.
And much less.
Yes, very well.
So, doctor, what would be a contraindication to undergoing bypass surgery?
So as such, contraindications means the patients whom have very less number of blockages, are discrete, or the patients who are hemodynamically unstable, or the patient who had recently stroke, they got a stroke.
Right.
In that, definitely the bypass
certain
operation
level of
should be
contraindication.
avoided, remained.
Yeah.
And as I told you, the patients, in case of if you are considering for total arterial bypass, the patient, in that patient, the patients who have very diabetes on the heavy side, like whose HbA1c is on the higher side, who are obese,
Or uncontrolled diabetes.
uncontrolled diabetes, obese patient, females patient, in that we avoid the total arterial bypass because to avoid the risk of, we call it something called as sternal osteomyelitis, or infection of the sternum, wound infections of the, basically that's.
Is kidney disease also a contraindication to
not such. Kidney diseases
bypass?
or CKD is not a contraindication definitely for doing a bypass or angioplasty also, because see, these are the patients who are actually more prone to get a coronary artery disease because of their itself nature of the illness. They are more prone, and they are quite symptomatic. So here only in Manipal, we did a lot of patients who are already on the dialysis, or who have the high creatinine levels, and they underwent bypass operation, and they are doing good. The only risk remains in all these patients, like if their creatinine level is a little bit on the higher side, post operation they have little bit chances that may get worsen. They may land up on the dialysis if they are not there. And one of the advantage of beating heart surgery is this one, that the patients whose creat level is on the higher side, or they are chances of they will have less kidney injury and less chances that they might land up on dialysis or kidney, means worsening of the kidney condition after doing the bypass. For ideal patient, kidney condition is not a contraindication.
Right. Doctor, what would be the advantages that you would see and you would tell a patient once they undergo cardiac bypass surgery?
See, the whole purpose of always when patient come to us, they talk to a little, because this is being
it's a big surgery.
No? It's surgery, so family decision, surgery, families questions, families will everything. See, the basic purpose of doing a bypass surgery is like to give a patient full chance of leading a normal life post surgery. I'm telling you, because see, so what we look at as a patient, when I talk to the patient or when we counsel the patient, is that we tell that, see, the surgical part, like from the day of your admission to your surgery, that will be almost 7 days you will be in the hospitalized. Out of that 1 or 2 days you will be in the ICU, another 3 to 4. Right. But it's not like that you have to be bedridden immediately. Once we do the surgery, once the patient is out of the ICU, we try to mobilize by the time they go home. We make sure that here in Manipal that they go home walking on their own, walking the staircase, by doing the physiotherapy and all those things. So they have to definitely take care for at least for 15-20, you can say a month's time, because of the wounds and all those things. But after that, definitely they can lead a normal life. Right. I have patients who are young patients who has undergone, say, now they are swimming, they are doing cycling, they are doing their jobs, their activities. So that's right. So it's not like that. Some people in the mindset after doing bypass, I have to lie down. It's not like that. Definitely.
But of course there is a restriction where they have to continue their medications and take a certain amount of care.
Yes. See, either you do bypass, you do angioplasty, or don't do anything. Certain medicines like your blood thinners, your cholesterol tablet, your sugar tablets or injection, whatever,
those have to be continued.
And many is your like your diet, your lifestyle, that has to be followed. There is no escape from that.
Right. So, doctor, that was about heart attacks and their management. Now, could you tell our viewers more about valvular heart diseases?
Yes. So, second strata of patient what we see in the cardiac surgery, adult cardiac surgery, I'm saying, is the, like as I told you, valvular heart surgery. As we have 4 heart valves in the 4 total valves of in our heart.
In the heart.
So most of the time on the left-sided heart valves, they get affected more. Either of the we call as something disease we call as rheumatic fever. But I have not seen too much cases in Goa because socioeconomic status is good. Yes. And another thing now what we see is the degenerative changes we see, like Goa population, we say the people who live more than 60-70 years, due to the aging, the valves get degenerated. They either become thick or they become regurgitant. So in that cases, we call as we have the option of doing what we call as valve replacement surgery. Because of newer advent in it is open heart surgery, but newer advent in the valves what we are getting now, tissue valves. So they are very good size, they have good longevity. You don't have to take lifelong blood thinners or anticoagulant medicines. So they give you a good lifespan, better outcome. And these new valves, whatever they are coming, they are like that. If you do the surgery now, and after 10 years, if that valve get degenerate, in that after 10 years, you have an option of not doing the open heart again. You can manage that things by the new techniques like that we call as TAVI or something. Definitely.
Right. So what is this new technique of TAVI?
See, this is mostly for the treatment of the aortic valve or aortic stenosis. So this was actually basically started in the patients who are quite sick, as I told you, who are quite old age with their sick and they are not fit to undergo the open heart surgery. In that they have come with this valve which is put through like what we do the angioplasty same thing through your groin. They go inside and that valve is put in the aorta, and the patient can, we have seen many patients who have come out of the ICUs and they are leading at least not a, they will not die, better life, what is called. Yes, it's not like I told you they will be able to, but they will need a better life. It is called actually TAVI.
Right. So this was about valvular heart disease. Besides this, we also have congenital heart diseases that also require surgery. What are those and what is your approach to that?
So basically, I discussed initially the congenital heart diseases, which are mostly seen in case of the pediatric population. Yes. These are because now due to the recent advent in the antenatal care thing, most of the congenital heart disease can be diagnosed before the delivery itself. So because of that, there are some congenital heart diseases which are not amenable to survive after this. So those can be patient can terminate. But there are most of the things are we call as those are divided into two, like cyanotic or blue baby syndrome, and other are we call as acyanotic.
Correct.
So most of these are either because of the hole in the heart, which they call as either atrial septal defect or ventricular septal defect. And the blue baby syndrome, what we call as, there are most of the scar condition what we see in the practice is we call as tetralogy, TOF or tetralogy of failure.
Right.
So these conditions can be diagnosed by doing a simple test like 2D echo, as I told you. So some of those conditions are managed currently medically initially if they are not reaching immediate intervention. Some requires immediate intervention. But now because of the recent advances of pediatric cardiology, many of those conditions can manage with interventions definitely nowadays, because and the conditions which are not amenable for the intervention, they require open heart surgery at either at the early age or when they grow and little become more than 10 kg or weight, and when they can tolerate the surgery, such can be done later on when required.
Right. So doctor, for the patients who undergo bypass surgery, or for that matter even valvular heart surgery, what would be your post-care tips that you would like to share with your patients?
Yes, so as I told you, so when these patients are going home, we tell them to follow the most of the what we call as your medications, your activity. Definitely, it's not like that after, as I mentioned before, that they should be bedridden or lying down. They should be active. They should be. So I always tell, we don't want to run the marathon, but walking is the best exercise they can do.
Right.
So at least they should, after the bypass also, they should start doing this activity, walking. Take care of their sugars, take care of their cholesterol, take the medicine, they can go for the repeated, many a doctor you calls for the follow-ups. So if anything is there, we can find it out and treat
regular
them.
Regular
checkups, your 2D echo, ECG, those are the things which should be followed for after any open heart surgery or any intervention, cardiac intervention, what I suggest.
Yeah, right. Doctor, what would be your take-home message to all our viewers with regards to cardiac diseases and their management?
See, my take-home message will, the cardiac diseases are increasing, they will increase. So first, to avoid these things, you should avoid the risk factors. Okay,
so
that is the first thing. Lifestyle. Most of the and one thing I want to do, nowadays we are seeing the most of the young cardiac patients. Like
so is there a particular reason for it?
So I think the particular reason, see, mostly maybe the lifestyle has changed, your diet, your stress everybody is called, it's like a rat race is going on. So I think,
and also there is more increase in smoking among the youngsters.
Yes, so habits, like we call it these habits, like smoking or tobacco abuse in any form is bad. So these are so that's why we are seeing what we call as cardiac condition young is like the person who requires cardiac in the 45 before that we are seeing. So I did the bypass for as young as 39 to 43 years old patient. So that is the thing which is coming up and which is very surprising to our fraternity also. So take home message will be, so try to keep your heart fit, try to you should do exercise, do meditation, your diet, your sugar, your cholesterol, your blood pressure, all these things evaluate. Don't consider that I am the one, nothing will happen or to me or nothing. And another thing you are saying that like young sudden is that craze of gymming, going to the gym and doing so. See, each person has different level, so you cannot, everybody cannot just become Arnold Schwarzenegger or like that's why. So it is individualized. Exercise, that's why I said, so most important exercise is be active, like walking or running or your cycling or your swimming. That is more than enough for heart. We don't require biceps or triceps to save your heart.
And if your heart is fit, then
everything you can do in the life. What I feel is that.
Thank you so much, doctor, for spending time and sharing with us your views on cardiac disease and the management. Dr. Rakesh Deshmane is available at Manipal Hospital, Goa every day, Monday to Saturday for consultations. Until the next episode of Health Mantra, stay fit, stay healthy, take care and keep watching Prudent.